Hello! So if you have watched my previous video, you would have gotten some amazing recommendations of exercises to do during pregnancy, and you'd also learn about all the benefits for mom and baby. So today we're going to chat about something that might be more beneficial than the exercises that I mentioned. But before we get into that, I just want to run over some changes that happens in the body when you are pregnant. And some of these are affected by weight gain and some of these are not affected by weight gain. So if you are gaining more than the prescribed amount, some of these might be applicable to you, and if not, cool, at least then you have the information for free. Ta-da! Okay, so some changes that have no effect and are not affected by weight gain, everyone's going to go through this, are hormonal changes, cardiocirculatory changes, thermoregulatory changes, and metabolic changes. So we're going to quickly run through these because these are a lot of things that I want to tell you, and I've got a little bit amount of time. So firstly, hormonal changes. You know your hormones are all over the place. That's why you're being so mean to your husband. That's why you're kicking the dog. That's why you don't want to go to work. All these hormones are just making you cry and then feel happy and then sad and angry all at the same time. Take a deep breath. It is going to be okay. There is one hormone though that is really, really important during pregnancy, and that is called relaxin. As the name suggests, it relaxes your joints, your muscles, and connective tissue in preparation for the expansion of your body for your baby's growth. So imagine if you had to stay exactly the same size before you got pregnant, all the way during your pregnancy, you'd be in excruciating pain. But our bodies are amazing, and it produces this hormone, relaxin, to help us relax the joints and connective tissue, to create space within our body, and also to open up our pelvis for when labor comes. So because of this relaxin, it increases our mobility. So if you watched my previous video, I said if you couldn't do the splits before, don't go do them now. I meant that because you will most likely be able to get into the splits, but you won't be able to get out of those splits because the strength in the muscles aren't there to support you to get back up. So you'll have stretched them, but they'll still be weak muscles. So don't go do the splits. Anyway, with a greater mobility comes decreased stability. So that's why you might be a little bit wobbly on your feet. And this is why a lot of trainers don't want to work with prenatal women or pregnant women, because there is a higher risk of injury. So especially for single-legged movements where your stability is a little bit off, you might fall over, you might hurt yourself while doing some lunges. So it is best to work with someone who actually knows what they're doing and who is comfortable working with prenatal women. There's no use taking your regular trainer and forcing them to train you if they're not comfortable and if they have no idea how to help you. Okay, so our next one is cardiocirculatory changes. That basically means that your cardiac output increases during pregnancy. Your heart is pumping a lot more blood per beat while you're pregnant than when you're not pregnant. Up to 40% more by the end of the third trimester. That is a lot. And so obviously, because it's pumping more blood, your heart rate increases. So it means also that our heart rate is no longer a good and accurate indication of how hard you're working. So if you used to walk on the treadmill and check your heart rate and you're like, oh, it's between like 120, 140 beats, that's good, the internet says that's fine. Right now, that's not a good and accurate indication of how hard your body's working. So we use something called RPE, rate of perceived exertion. Okay, that means you've got to listen to your body. If you're doing a lot of exercises and your body's like, yo, cut it out, I am done, please take a rest, sit down, relax. Your body's done, it's tired. Don't push it past a point and be like, oh, my heart rate's only like 120. No, listen to your body, be intuitive, feel what's going on, act accordingly. Okay, thermoregulatory changes. This is an important one. So if you've ever heard avoid the hot tub and the sauna during pregnancy, it's actually, that's a valid one. Listen to that one. So it can lead to, let me not say it, let me say overheating. As a pregnant mom, overheating can lead to birth defects, especially within the first trimester while critical brain functions and bodily functions and organs are developing. So we want to avoid the hot tub and the sauna and humidity. You don't want to go do hot yoga when you're pregnant. Just no. There will be lots of time to do that after pregnancy. So what happens for our body to combat this is that we sweat a lot quicker. So if you're exercising, you're going to be sweating a lot, which is a good thing. That's your body's way of trying to cool you down the whole time. We lose more heat through respiration just by talking, just by breathing. Think of like a dog panting. I'm not going to do it. I want to do, but I'm not going to do it. It looks very silly. They expire heat while they're panting, and that's the same that you're doing while you're breathing in and out. That's why breathing is so important. You are actually excreting heat from your body. The other thing is we've got an increased skin to environment heat transfer. So if you go outside, you realize, oh wow, it's really hot. You're going to start sweating really, really quickly. And you might also feel uncomfortable, and that's your body's signal of saying, get out the sun, it's hot, go away, go sit in the shade. So how do we avoid overheating? Like I said, no training in high heat or humidity, no hot yoga, or if it's boiling outside, don't go train outside, go inside. You can do the same things inside. Avoid saunas, steam rooms, hot tubs, obviously. Wear clothes that allow you for sweat to evaporate. There's no use wearing a jersey and being drenched in sweat the whole time. It's not gonna cool you down. Take it off, no one's gonna care. We all know you're pregnant, we can see. Okay, drink lots and lots of water. No agua, no sweaty sweat. Okay, so drink lots of water. You need water to be able to sweat. Okay, here's just a little side tip for you. High intensity interval training, HIIT, won't overheat your body if the guidelines are followed correctly. So keep that thought, we're gonna get back to it. So last one is metabolic changes. So our blood sugar is our baby's primary source of energy. If you are not eating carbs during pregnancy, please eat some carbs. It's good for you and for your baby. Okay, because of the baby using our blood sugar really quickly, we have a tendency to have a lowered blood sugar. I'm saying we as if I'm pregnant. Guys, I'm not pregnant, okay? I'm done. One baby is enough for me. I'm good. Pregnant moms, I'll refer to them as pregnant moms from now on, just to avoid confusion. So your blood sugar will be lower, and this can cause dizziness, fatigue, might be a little foggy during the day. And so we suggest that you have a snack, a good carb-loaded, high-protein, low-fat snack 30 to 60 minutes before you come to training. If you didn't get a time to have a snack, throw an apple in your bag. You can eat an apple while we're training or in between rests. Just have a bar or something. Just have something. Don't go train on an empty stomach thinking that, oh, I don't want to gain weight. No, you're gonna faint and I'm gonna have to catch you. And I might not catch you, so just eat something. I'll catch you, I promise. Just don't faint. Okay, so here are the changes that are impacted by weight gain. So if we gain more than the prescribed amount, which is 25 to 30 pounds, about 10 to 15 kilograms, maybe 20 max, a lot of different things start happening and going, get away. Sorry, there's a bug. A lot of things start to go a little bit skew. So one of those things is that our alignment starts to change. And this is because of obviously the relaxin and the excess weight that we are carrying. So when we coach prenatal moms and postnatal moms, we focus a lot on the natural neutral alignment of the spine, which is the ribs over the hips, shoulders over ribs, We're getting a nice straight line, not arching the back, not sinking into the pelvis. I know you couldn't see much there, but I'll post about it later. So one of these alignment shifts that happen when we gain more than the recommended amount of weight, or sometimes even if you're carrying multiples, is that the center of gravity shifts forward and upward. So let me stand a little bit back. So if this is your little baby and this is your neutral position, you're gonna start looking like this and pretend I have a baby over here. So we immediately start arching our back. We get an anterior pelvic tilt to be able to support that weight going forward. A lot of moms then push into their knees, having like a locked knee type of, or sway back knees. If you didn't have those before, don't give them to yourself during pregnancy. Our shoulders start rounding because of the weight of our breasts filling with milk, and also the weight. If you're gaining more weight, you're getting more adipose tissue in your breast, so that's gonna bring the shoulders down, and that's worsened when we feed our babies eventually because we're breastfeeding like this. Ouch. And our pelvis widens even more, which causes us to do that little pregnancy waddle that we do walking side to side. Okay, so those are just some alignment changes. Also, it increases the intra-abdominal pressure in our stomach. So there is a small amount of intra-abdominal pressure that's needed for us to be able to move and walk and pick things up. But when we gain more weight than necessary, especially with the weight of the growing baby and with that pressure pressing on our linea alba, if you don't know what your linea alba is, it is the connective tissue that connects your rectus abdominis in the middle line of your abs. Keep watching my posts. I'll post about it in the next one, and I'll post about diastasis recti as well, so that you can have an idea of what's going on with your body after I mention all these things. So, okay. So because of the load that's increasing, and maybe you're doing the wrong type of exercises, you could cause diastasis recti. Diastasis recti is the linea alba thinning out more than it should, and it's bringing these muscles further away from each other. Once again, keep watching my posts. I will post a picture for you to see what is going on. Okay, so pelvic floor dysfunction is also one of the things that could happen due to this intra-abdominal pressure. So your baby is pressing out and forward and down as well. So if you, let's say, for instance, you're doing a squat and you're pushing out of your belly and you're pushing down onto your pelvic floor, something's gotta give. Something's gonna go bad. That is why we train in neutral position. We remember to close the ribs as best we can while pregnant, and we focus a lot more on our breathing. Once again, breathing is important. We're going to get to that. Okay, some of the exercises, like I said, can add pressure. And for checking diastasis recti, which will be in a post again, anything more than 2 finger separation. So if you have your fingers like this on your abdomen, if there's an indentation, if you press down, if there's an indentation more than 2 fingers width, that's diastasis recti, and I definitely suggest that you chat to someone about that. Maybe a trainer, you can chat to me, physio, anyone who can help you to heal that in an appropriate manner. Moving on to breathing. Okay, so because of the pressure in our body and the pressure on our diaphragm, we are very often short of breath. If you've ever walked up a flight of stairs when you're pregnant, you are half dead by the time you get to the top. I was. Don't know about you. If you're not dead, great. I'm happy for you. But because of that, we tend to breathe into our necks. Breathing up and down instead of out to the sides. One of the techniques we teach you during our training is to be able to breathe out into the ribcage and into the thoracic. That'll help you to place less strain on the shoulders, because you're going to need those shoulders later when you're breastfeeding and you're holding your baby and your arms are tired. So don't overwork these muscles, cause yourself a stiff neck. It's not worth it. Focus on breathing wide into the ribs. A nice way to do that is to place your hands on your ribs, and as you breathe in, you want the ribs to expand, and breathe out, you want them to fall sideways. So we're breathing out to the side and relaxed. More on that in a further post. So I just said we teach you proper breathing techniques, and that's how to combat the breathing into the shoulders thing. So last one that happens and that has effect with regards to weight gain is movement challenges. The pregnancy waddle. You've seen it, I've done it, you may be doing it too. It's not necessary. Actually, if you train your body correctly, you won't have the pregnancy waddle. Okay, but because of the extra weight gain and because of relaxin, we have an altered gait. So our steps become slightly shorter and we create a more movement shift of the body. So if you knew it or not, walking is actually a single leg movement. So as we step through, we actually have to place our weight onto the other leg. And because if there's excess weight, we have to place more weight onto that leg. Okay, so it becomes harder to give long, even steps. So we give shorter, larger weight shifted steps. We also have a bigger difficulty getting up and down, sitting down, getting up, walking down a flight of stairs. Moving in general becomes extremely difficult if you've gained more than the recommended amount of weight and if you've lowered your strength to weight ratio. Onto that, strength to weight ratio. Now, if you, this is just an example, the numbers are just examples, don't pay too much attention to the numbers. If you, for instance, were doing weightlifting before pregnancy and you could squat 100 kilos and you did that for 10 reps and it was easy for you. Now you fell pregnant and the trainers tell you, don't lift weights, body weight exercises only. And by the third trimester, you try to do squats again and you can only lift about 40 or 50 kilos for 2 or 3 reps because your body's exhausted, your muscles have deteriorated, they are disconditioned. Okay, that is because you stopped doing the same exercises and your body stopped using those muscles at such an exerted rate. So, what was I going to say? Strength to weight ratio, there we go. So we don't want to decrease our strength to weight ratio. So if your weight is going up like this the whole time through pregnancy and your strength is going down that way, that is not good. You don't want that. You ideally want to level out the strength to weight ratio. So if your weight is going up and your strength is still staying at the same level, or maybe even increase your strength, who knows? Depends on how much work you're willing to put in. We want to either keep the strength to weight ratio level, or we might even want to increase our strength to weight ratio. And the idea behind this is we don't want you to be at your weakest when you're at your heaviest, which is third trimester, the baby's about to come, and you are so weak that you can hardly make it through the day. You can't climb a flight of stairs, you are just exhausted, because when labor comes, you will be put through the ultimate challenge. And that brings me to my favorite part of this video. What prepares you more effectively for pregnancy, labor, and motherhood than those other exercises? So I'm gonna create an analogy for you here. If you were to run a marathon, let's say you've never run a marathon before, you want to go run a marathon. What's the first thing you're gonna do? You're gonna find out what it's gonna take to run a marathon. How far is it? How physically exerted do you have to be? How do you have to train for it? What do you have to eat? You know, you're gonna consider all these things. You're not just gonna be like, oh, I'll just show up on run day and I'll just wing it. No, you're going to train for it. And you're not going to train by just walking around the block every other day, because you'll never make it. You'll run, but you'll most likely be drop dead tired by the time you get to the finish line. So if we look at motherhood in the same aspect, when we fell pregnant, do we really, like, think about this, do we really consider what the physical demands of pregnancy is? How best to prepare ourselves for it? What would be required of us? What do we eat? What do we drink? How will we get to the point of labor in the most effective manner without injuring ourselves, so that we are so ready for labor that we're not exhausted during it and having to end up getting medical intervention? Do you consider those things? No, I didn't. I didn't even know about it. I just thought your body kind of just does it naturally, and when the baby's ready to come, it just pops out. Nope, it doesn't just pop out like that. Mm-mm. No. So, we follow a training performance-specific approach. Performance-specific, taking into account all the challenges, physical, emotional, mental, hormonal, all kinds of challenges that you will be going through during pregnancy. And we physically prepare your body not only for being strong enough to be able to handle the various stages of pregnancy, the weight you'll gain, the hormonal changes, but also preparing you for labor, which is like the ultimate high-intensity interval training workout. If you consider labor quickly, I know I've spoken to a lot of moms who've never really thought about labor. Girl, you're 24 weeks pregnant, you should be thinking about labor already. You have contractions, on and off, from mild contractions to more intense contractions to really, really intense contractions. And they can vary from 30 seconds contractions to 2 to 5 minute rest to 60-second contractions where your body is in agonizing pain, to like a minute off or 2 minutes off, and then another 60-second contraction, and then a minute or two off. So you're constantly working, exerting yourself, and then giving very minimal time to rest, and then exerting yourself, and then minimal time to rest. If you did nothing throughout your whole pregnancy, you will be exhausted by the time the first stage of labor ends. And now you still have to push, which is the most physically demanding, because if you can't have the energy to push your baby out, they will get the little forceps thingy, it's gonna grab your baby like this, pull it out. Don't do that to your poor child. Work through your pregnancy to be able to push your baby out. I never got there. I was so exhausted from my first stage of pregnancy that I could not do it. And I'd only dilated like 4 centimeters. So the doctor was like, nope, I'm calling it C-section. There goes that plan. So, performance-specific training. Not only do we train you for pregnancy, we train you for labor and motherhood. Daily activities of motherhood are quite strenuous on your body. You will be picking your baby up so many times a day. You will be feeding your baby so many times a day. You'll be putting your baby down so many times a day. You'll be on the floor, off the floor, in the car, out the car, carrying a car seat, carrying the groceries, physically demanding your body to work at top performance the whole day, and all while recovering from either natural birth or C-section. That's a lot to ask your body with no prior preparation. So, if you want to find out more about performance training for pregnant women and postpartum women, watch the next video.